Alright, so this is Gauche, right?
Mary Beth.
It's
Pretty sure it's gauche.
Really? Guys? I think it's that time again.
What do you mean?
I need a smoke break. I can't learn this.
Another one?
Another one?
Really?
Yeah, another one. I'm going.
I never know.
That is ridiculous.
This is her sixth cigarette.
She needs to study.
I mean, what can we do though? You know, like...
Her smoking habits are disgusting.
It is. Very. Maybe we should talk to her.
Yeah, maybe we should.
You should.
I think you should.
Yeah.
You want
You know,
me to tell her?
You're the man, you know. Why not?
Alright, I'll go for it. Be right back.
Good luck. Be gentle.
Right back.
Okay, so I'm trying to make a study guide for the health promo. Did you understand this stuff?
No. I think we should ask JR when he gets back.
It's taking so long.
I think I was gonna just quickly tell her something to come back, but.
Maybe I should go do it.
Okay.
Call me the shark. I'll be back.
Okay. Where are they? Oh my gosh, I gotta knock some sense into them. Time to intervene.
Mary Beth, what are you doing?
Smoking, taking a break, done with homos.
Why do you smoke cigarettes? Everybody told me to come down here and tell you how bad cigarettes are. You need to smoke something that's a little less on your lungs. Like cigars.
Less? I'll stick to my cigarettes.
You don't even inhale the smoke.
Excuse me. What are you doing?
What does that look like we're doing?
It looks like you're smoking. And it looks, I told him to come talk to you about your bad habits. And you're out here smoking with her.
Are you my mom?
Did you even see the sign? Look at the sign. No smoking. And besides, smoking is so bad on your lungs. You need to try something like this.
What in the world is that?
It's chewing tobacco. And I can do it in a no smoking area.
That is nasty.
Did you just put that in your mouth?
That's nasty.
That's disgusting.
What are you guys doing? What are you guys doing? We're supposed to be studying. And you guys are acting stupid.
Just take a break.
Let me tell you about tobacco, okay? Come on, guys.
What is tobacco and its use, and why do we care? Tobacco is a natively grown plant in North and South America. Tobacco contains many chemicals, but the most popular and the number one active constituent is nicotine. Nicotine is also one of the most heavily used addictive drugs. Tobacco can be used in several different forms such as bidis, cigarettes, cigars, electronic cigarettes, hookah, kredex, pipe, and smokeless tobacco, which includes chewing tobacco and snuff. Tobacco use is the leading preventable cause of death. In the United States, tobacco use is responsible for about 1 in 5 deaths each year. That's about 443,000 deaths per year, and around 49,000 of these are from secondhand smoke exposure. Cigarette smoking costs more than $193 billion each year. Secondhand smoke costs more than $10 billion each year. 19.3% of the United States population, of which is about 45.3 million people age 18 and over, were current smokers in 2010. Each day, more than 3,800 people younger than age 18 smoke their first cigarette. Many adult smokers want to quit. Approximately 69% of smokers want to quit completely, and pharmacists can help. Why should pharmacists play a part? Pharmacists are the most accessible health provider positioned directly in the community. Patients interact with community pharmacists on a regular basis. Pharmacists believe they should be more involved in helping patients to quit smoking. Smokers feel that community pharmacies are more convenient and that counseling would be beneficial for helping them quit. Pharmacists and patients typically have a long-term relationship established, and there is a good bit of trust put in the pharmacy. Surveys have shown that pharmacists are the most trusted profession. Pharmacists also have the education about medication use, dosing, adverse effects, interactions, and can even help to select the correct dosage form. Pharmacists are also those that are dispensing medication. Even brief counseling sessions followed by a referral to the Tobacco Quit line can increase patient success. So what have pharmacists already done? Development of the 5 A's approach, in which the pharmacy is to ask about tobacco use each time the patient visits the pharmacy, advise patients to quit smoking if they are current users, assess how willing the patient is to quit, assist the patient with quitting, and arrange follow-up sessions for counseling. However, currently the approach is found to be hard to use in practice. Significant barriers such as time, reimbursement, and many pharmacists also feel they do not know what to tell patients to encourage cessation. The time barrier can be addressed. Even minimal contact, less than 3 minutes, can increase rates of cessation by 2%. As contact time increases, this rate increases. Brief follow-up sessions also increase success. Involving multiple types of providers can help to increase quit rates. Since nicotine replacement is available over the counter, pharmacists are in the unique position in which they can provide counseling or help at point of sale. Pharmacy schools are increasingly incorporating training programs for smoking cessation to give counseling skills to help patients quit smoking. However, few actually actively engage patients. Currently, most documentation available shows studies of how a pharmacist could help with cessation of tobacco use. However, there is little information about what pharmacists have already done to help with this problem. What kind of opportunities do pharmacists have in cessation of tobacco use? The primary preventable cause of morbidity and mortality in the United States is smoking cigarettes. Tobacco use treatment has been ranked as one of the top 3 preventative and cost-saving services that is most efficacious, cost-effective, and has the highest impact. Changes in lifestyle, such as smoking cessation, are extremely effective in lowering the risk of heart attack or stroke. So who is affected in the United States? More than 1 in 5 adults smoke. 22% of adolescents are smokers. Who wants to quit? 69% of smokers want to quit. 41% tried to quit for at least 24 hours. Who is successful? 5% of the smokers who attempt to quit are successful for 3 to 12 months. Who can help? 80% of people talk to their general practitioner once a year. 68% of people see their pharmacist at least once a month. What can pharmacists do? They can provide screening, provide cessation counseling, improve access to help patients choose the best service to help them stop smoking, provide support, resources, and follow-up, and provide structured documentation. What challenges do pharmacists face? Economic pressures. Health plan or Medicaid reimbursement may not exist or may not be enough. This may end up being a free service. Free services only add up to time pressures due to lack of reimbursement. Time pressures. A typical 15-minute office visit requires about 10 minutes one-on-one between patients and doctors. Clinicians want their patients to stop smoking, but do not use the short time to approach the issue. Tobacco use treatment may not be the top priority for a short visit. Patients rarely make an appointment for help with smoking cessation. What can doctors do to alleviate time pressures? They can address the time constraints, and referrals can be made to telephone counseling quit lines. Reimbursement. Doctors usually are not reimbursed for providing effective evidence-based treatments for smokers. Reimbursement is not the main factor behind care delivery, but it may be a negative impact on treatments. Payment methods are shifting back to fee-for-service and away from capitation. Under fee-for-service, it is moving away from services such as intensive tobacco use treatment counseling that are harder to quantify and therefore harder to bill. Where can pharmacists go from here? Some of the future objectives that Healthy People 2020 want to achieve are to reduce illness, disability, and death related to the use of tobacco and secondhand smoke exposure. Pharmacists can deliver care personally using the 5 A's to decrease tobacco use. They can ask about tobacco use when asking about vital signs like making tobacco use a vital sign, advise tobacco users to quit, assess readiness to make a quit attempt, assist with the quit attempt, arrange follow-up care. Pharmacists can also offer nicotine replacement therapies to all smokers trying to quit if appropriate. Some of the nicotine replacement therapies include nicotine patches, lozenges, nicotine gum, and prescription medications. All patients entering the pharmacy should have their tobacco use assessed routinely, and it should be updated and noted on the patient profile. Pharmacists are the most easily accessible and should make themselves available to talk with patients about smoking cessation.